Cracking your knuckles is a habit that many people have, but it often comes with warnings from friends and family. The most common warning is that cracking your knuckles will cause arthritis. This belief is widespread and has been passed down through generations. However, scientific research does not support the idea that cracking knuckles causes arthritis. Let's explore why this myth persists and what the science says about knuckle cracking and arthritis. When you crack your knuckles, you're pulling the bones apart, which creates negative pressure within the joint. This pressure change causes bubbles of gas, mainly nitrogen, in the synovial fluid, the lubricant in your joints, to burst. The popping sound is the result of these gas bubbles collapsing. While this can be loud and sometimes startling, it is generally harmless. Arthritis is a term that encompasses over 100 different conditions affecting the joints. The most common types are osteoarthritis and rheumatoid arthritis. Osteoarthritis involves the wearing down of cartilage, the tissue that covers the ends of bones in a joint. Rheumatoid arthritis is an autoimmune disorder where the body's immune system attacks the joints, leading to inflammation and pain. Both conditions cause joint pain and stiffness, but their underlying causes are different and complex. The belief that cracking knuckles causes arthritis likely stems from the fact that the habit can be annoying or perceived as socially undesirable. People may have associated the sound with something harmful or damaging over time. However, this association is not based on scientific evidence. Several studies have investigated the link between knuckle cracking and arthritis. One of the most well-known studies was conducted by Dr. Donald Unger, who cracked the knuckles on his left hand at least twice a day for over 60 years while not cracking the knuckles on his right hand. After more than 6 decades, he found no difference in the incidence of arthritis between his two hands. His self-experiment earned him the 2009 Ig Nobel Prize in Medicine, a parody of the Nobel Prize, which honors achievements that first make people laugh and then make them think. In a more comprehensive study published in 1990 in the journal Annals of the Rheumatic Diseases, researchers examined the hands of 300 people over the age of 45. The study found no significant difference in the incidence of arthritis between those who regularly cracked their knuckles and those who did not. Another study published in 1975 in the journal Arthritis and Rheumatology also found no link between knuckle cracking and arthritis. While these studies show that knuckle cracking does not cause arthritis, they did observe some minor effects. For instance, habitual knuckle crackers were more likely to have some hand swelling and reduced grip strength compared to those who did not crack their knuckles. However, these effects are not harmful and do not lead to arthritis. It's also important to note that the discomfort some people feel in their joints, which leads them to crack their knuckles, can be due to other underlying issues, such as ligament or tendon problems, not the act of cracking itself. Cracking your knuckles can provide temporary relief from this discomfort by stretching the joint and increasing mobility. Arthritis has many risk factors, including age, genetics, joint injuries, obesity, and repetitive stress on the joints. These factors can contribute to the development of arthritis, but knuckle cracking is not one of them. Maintaining a healthy weight, staying active, avoiding joint injuries, and managing underlying health conditions are more effective strategies for preventing arthritis. Despite the lack of evidence linking knuckle cracking to arthritis, some people might still prefer to avoid the habit due to social stigma or personal preference. If you find that knuckle cracking annoys those around you, or you simply want to stop, there are a few strategies you can try. Keeping your hands busy with activities like squeezing a stress ball, using a fidget spinner, or engaging in hand-strengthening exercises can help reduce the urge to crack your knuckles. In summary, cracking your knuckles does not cause arthritis. This myth likely persists due to the social stigma around the habit and the misassociation of the popping sound with joint damage. Scientific studies have consistently shown no link between knuckle cracking and the development of arthritis. While habitual knuckle cracking may lead to minor effects like hand swelling and reduced grip strength, these are not harmful and do not lead to arthritis. Understanding the true risk factors for arthritis and focusing on healthy joint practices is key to preventing the condition. So if you enjoy cracking your knuckles, you can continue to do so without worrying about developing arthritis.